How did chest X-ray diagnose TB before modern tests? Imagine a time when doctors relied mainly on their eyes and simple images to find out if someone had tuberculosis. Before modern tests like bacterial cultures or molecular diagnostics, chest X-rays were the main way to spot signs of TB in the lungs. When X-ray technology was discovered in the late 1800s, doctors quickly saw how useful it could be for lung diseases. They started taking chest images to look for telltale signs of tuberculosis. These signs included areas where the lung tissue looked cloudy or solid, known as infiltrates or consolidations, which happen when infection causes fluid and cells to fill the lungs. Sometimes, the disease caused hollow spaces called cavities, which are areas where lung tissue has been destroyed. Enlarged lymph nodes near the lungs, especially in the middle of the chest, also appeared as swelling or shadows on the X-ray, indicating possible TB spread. Old or healed TB could leave scars or small nodules, which showed past infection. The standard view was a posterior-anterior chest X-ray, where the image was taken from behind the patient to clearly see the lungs. Radiologists would carefully examine these images for patterns typical of TB. They looked for lesions mostly in the upper parts of the lungs, since active TB tends to settle there. But it's important to remember that these signs weren't exclusive to TB. Other lung diseases could look similar on X-rays, so doctors used the images as a clue rather than a definitive proof. They combined X-ray findings with symptoms like cough, weight loss, and fever, and sometimes with skin tests like the tuberculin skin test to make a diagnosis. In children and people with weakened immune systems, TB might show up differently, such as more lymph nodes swelling or fluid around the lungs. The X-ray was also useful to monitor how well treatment was working or to spot complications. Before microbiological tests, chest X-rays were vital in guiding treatment decisions and helping doctors decide who needed more testing or care. While they couldn't confirm TB with absolute certainty, these images helped identify likely cases early, especially when combined with clinical signs. So, in essence, chest X-rays diagnosed TB before modern tests by revealing characteristic lung abnormalities that suggested infection. They served as a valuable screening and monitoring tool, helping doctors act sooner even without bacteriological confirmation. Always remember, though, that a proper diagnosis requires a healthcare professional's evaluation, and modern tests now provide more definitive proof. If you suspect TB or have concerns, consult a healthcare provider for appropriate testing and care.